Okay, so you're welcome back to my channel. You're welcome back. This is Annie's space on your screen. I film about nursing, health, lifestyle, and faith. So yeah, if this is a content you're interested in, you're a nursing student, you have someone who is in nursing school, you have someone who is in nursing, you like hearing, talk about health, lifestyle, faith, this is a channel you want to subscribe to. So if you're watching this video and you've not subscribed, just go and subscribe. You see the subscribe button down below, just subscribe, then you come back and yeah, you keep watching. So by today's video, or by the title of today's video, you already know what I want to talk about. I'll be talking about postpartum depression following a movie I watched on Netflix. So yeah, if this is something you're interested in, do sit back, relax, grab your juice, come back and enjoy. So yeah, I'll see you in the next break. So you're welcome back. Yeah, I said I was going to be talking about postpartum depression when this video following a movie I watched on Netflix named For Maria Ebun Pataki. For Maria, okay, yeah, that's the name. For Maria Ebun Pataki. It's a movie by Netflix. I don't even know who directed. I've forgotten who directed the movie, but Kule Afolayan acted the movie. This lady, I've forgotten her name. Then Tina Mba acted the movie also, and a rest of them. There were not so many characters in the movie, but the movie was educative. It's just that I didn't like the way it ended. I don't just like the way it ended. I did not like the notes on which that movie ended. Yeah. So please ignore this ice cream noise. Like, although Nigeria is so full of noise, you can never do video in peace without noise. Like, please just ignore and focus on this fine face. Focus on the information I have for you. Yeah, so thank you. So as I was saying, it was a movie about a lady who went through childbirth. I think she went through CS, and prior to the CS, or following the CS, it's not prior. Following the CS, or like after the CS, I think she lost her fallopian tubes. Yeah, she lost her fallopian tube. So by that means she was not able to give birth again. So she had the baby through CS. I don't know, one complication or the other. She lost her fallopian tube. She didn't have a womb again after the childbirth. So yeah, and after the delivery, she got home with her baby. Her husband was with her. Her mother-in-law was also with her. And throughout the movie, she looked so depressed. She was not happy. She was exhibiting some characters that were not there before she put to bed, or before she had her baby. She was exhibiting some characters that were not there before. And her husband noticed it. She was so indifferent about her baby. She did not even care about her baby. Whenever the baby is crying, she starts feeling somehow. She's so afraid to carry her baby, like her own baby. She cannot even carry her own baby. Her mother-in-law, is either her mother-in-law will carry the baby or her husband will carry the baby. She could not carry her baby. Her baby would be crying. She would just be staring at her baby. She could not breastfeed her baby and all that. So it was kind of, it was that bad. And this was what the husband noticed and was asking her, what's the problem? Why are you so indifferent about this child? Why can't you carry your own baby? All the stuff. And it was becoming a problem in the house. She was always withdrawn to herself, always lost in thought. You'll be talking to her, she will not even hear what you are. She will not even be interested in the conversation. Her friends will come around. She will not want to see them. Even during the naming ceremony of the baby, she was not herself. In the middle of the party or the ceremony, she went to her room. She didn't want to see visitors. She didn't want to see friends. And like every behavior she was exhibiting was actually a form of, it was actually directed to postpartum depression. And that is what is driving me now into this topic. So at the end of the day, her mother-in-law thought it was spiritual. Her mother-in-law would go and carry holy water and start sprinkling on her, and pray, and sprinkle around the room and all that. So at a point she got tired, she got fed up, the lady got tired, got fed up, and told her husband that she doesn't want the mother-in-law around again, that she wants to see if she can be able to, take care of her child by herself. And the mother-in-law had to leave for peace to reign. The husband respected her, decisions, and had to tell his mother to go. Then after that, she tried, doing all this, trying she tried taking care of the baby by herself, but she was still finding it so difficult to, put the baby to sleep or pet the baby whenever the baby is crying. So after everything, after all said and done, there was a point where she started looking at herself in the mirror. She noticed she has added weight. She was not herself. She didn't look as beautiful as she was when she had not given birth. So all these things were just part of the problem she was going through. She felt like this child was not supposed to be born, or this child is a threat to her. And at the end of the day, nothing was done. I think she tried going to see a therapist or the hospital, but at the end of the day, it wasn't taking that serious. And the husband went out one day, came back, and found her in the bathtub in her own pool of blood. That was how sad it was. That was how that movie ended. And I was like, wait, don't tell me this movie has ended. No, no, no. Like, I had to, like, fast forward to make sure that the movie had actually ended, because at the end of the day, I was thinking maybe they would see her through a therapist, follow her up, and she might get over it. But she died. I was so heartbroken. My heart is still intact though. My heart is still intact, but you know what I mean. Like, I was not happy about it that the movie ended that way. So that is what is going to lead me into this topic called postpartum depression. So now, if you're watching this video and you don't know what postpartum depression is, it is actually another name for postpartum depression is baby blues. Yeah, baby blues. And it's a condition that happens in women who have given birth from like 2 weeks of childbirth down to 4 weeks, where there is a change in their social, mental, emotional behavior, a kind of change. And the cause is not exactly known, but from research it's been said that it could be due to fall in hormones. The estrogen and progesterone change, fluctuation in hormones might be the cause. And yeah, and the risk factor, or people that this occurs in mostly, are people with a younger age, like people who delivered at a very tender age, maybe from 18, 19, 20, 21. Those people who delivered at a very young age, maybe they were not ready for pregnancy. It was unexpected. It was that kind of thing. So it affects those kind of people. It affects women who are multiparity. What I'm trying to say is, it affects women who has given birth to more than 2 or 3 children. The higher the number of children, the greater the chance of having postpartum depression. Yeah. So, and it also it can be genetics. You might look at that person gene, you might look at the family history, and you notice that almost every woman in that family, whenever they give birth, they go through postpartum depression. Yeah, so that is it. Signs and symptoms. This includes indifference towards the baby, always withdrawn, inability to eat, inability to sleep, always scared of the baby's cry. That is another thing. Indifference towards the baby, being too sad, lonely, withdrawn. And yeah, those are the basic symptoms, signs and symptoms you are going to see in someone who is going through postpartum depression. The person will be able to eat, the person will be able to sleep well, always sad, crying, indifferent towards the baby, will not breastfeed the baby, would allow the baby to cry all day. She might even pose a threat. She might be a threat to the baby. She might want to kill the baby. Yes. Suicidal thoughts. She might want to kill herself. Yeah, so those are the basic signs and symptoms. And it's very important that we actually look out for people, especially people in this category, if you're a man, or you're a sister to a woman who just gave birth, or you're a husband to a woman who just gave birth, you're a mother-in-law to a woman who just gave birth, please be on the lookout for her. Watch her behavior, watch what she's going through. How is her action towards the baby? How does she behave when she's with the baby? Does she care for the baby? Does she bond with the baby? Is she always ready to carry this baby in her arms? Those are the things you look out for. What are the type of things she says, so that is our part to play. And there are two ways to treat this. One is medical and the other is the counseling. On the medical part, you can report to a doctor, you can complain to the doctor, see a doctor, explain to the doctor what you're going through. If you're a woman and you know you're going through this, or you are a relative to the woman who is going through this, report to a doctor. Make sure you report to a doctor first of all, then the doctor will put you through on what to do. And the second is counseling. She might be, she might be advised to go for a counseling class, or or see a therapist, someone who can help her, overcome this depression of a teen, this postpartum depression of a teen. Yeah, so that is basically it. I know I've encountered somebody like that. The woman gave birth to triplets, and from the information I got, that she had been in the hospital for 2 weeks after birth. So, and when she was going home, I noticed that when I just saw her, like I was working in school. Then I was working, and I saw her with her 3 children. I think she was carrying one, and her mother-in-law was carrying the other two or so. But she gave birth to triplets. So I was elated, I was so happy, I was joyful. I was like, wow, triplets. So I went to her, I was like, congratulations, ma. Someone was not even smiling. There was no smile on her face. As for someone that gave birth to 3 children now at a go. So she was not, she didn't even reply me. I thought she did not hear me. I said, ma, congratulations. She looked at me. She didn't smile. She didn't say anything. And I had to go and tell the mother-in-law, congratulations, ma. Oh. It was the mother-in-law that now answered me. And, I noticed that she was not just happy. I don't know if it's for that moment, or it has been, or it started since when she was in the hospital. I really don't know. I can't say. But I noticed that she was not happy. No, there's this joy when you give birth to a baby and you are so happy. Finally, you've given birth. There's this joy that comes with it. But that woman was not happy. And I just pray that the people around her will be sensitive enough to notice that she was not actually happy. So yeah, I think I'm done. I've described what postpartum depression is. I've given the signs and symptoms, so you can watch out for women who has given birth and maybe they are going through this stuff, or anybody, or your relative, or someone around you that is possessing this kind of attitude. You know what to do. And I've said that the treatment for this is basically medical and counseling, in that you see the person sees a therapist, goes through a counseling class, just to get back into the society. And yeah, the risk factor I've also mentioned, that I said it can occur in women who are younger in age, especially women that give birth to children out of wedlock or unwanted pregnancy. They are the ones who suffer this the most. Also, women who has given birth to more than 2 to 3 children, the higher they give birth, the higher the chance of having postpartum depression. And also genetics, it can run in the family. It might be from the mother side, it might be from the father side. But if you check within, you will notice that this thing runs in the family somehow. So yeah, please, let's be on the lookout. Let's watch out for the way people behave around us. If it deviates from their normal behavior, you are supposed to know that something is wrong. Yeah, so that they will not end up killing themselves, or taking their own lives, or even taking the lives of their babies. Yeah, so I think I've come to the end of this video. Thank you for watching. If you like this video, please give it a thumbs up. If you have not subscribed yet and you've watched to this point, please just go back, check down below. You see the subscription button is like this. Just subscribe, hit the subscription button, and you're subscribed to this video. Thank you. If you want more of this content, or you want me to talk about anything, just put it in the comment section. Also, have you encountered someone going through postpartum depression? Let me know in the comment section. Have you seen anyone going through postpartum depression? Let me know in the comment section, and I'll see you in the next one. Bye.